think we should go. Yeah.
I made it. Oh.
Yeah. Okay.
Okay. Hi, everyone. Today we're going to talk about something important, dental health. It's something important. It's something that matters to all of us. My name is Shai. I'm excited to be your host for this live show. We've got a great show lined up. We'll be talking with Dr. Kumar Vadivel, also known as Dr. V. He's a super smart dentist who knows a lot about teeth. He's going to tell us about the newest things in dentistry, how to keep our teeth healthy, and ways to get dental care that doesn't cost too much. Whether you know a lot about teeth or just want to learn how to keep your smile bright, you'll find something interesting here. We'll cover many topics like why brushing your teeth is important and what's new in dental technology. We've already got some questions from you, our viewers, and we'll answer them. Plus, you can ask more questions during the show. Before we start, let me tell you more about Dr. V. He's not just any dentist, he's a periodontist, which means he's an expert in certain types of dental care. He works at ToothHQ Dental Specialists in the Dallas-Fort Worth area in Texas. And guess what? He's even writing a book that's coming out next year. If you want to know more about Dr. V, check out our website at www.mytoothhq.com. So let's get comfortable and ready to learn lots of cool stuff about taking care of our teeth. Let's begin our dental live show. Welcome, everyone. And now let's welcome Dr. V and start our show.
Perfect. Thank you very much. Awesome.
Let's
awesome.
go.
Hi, everyone. I'm Dr. Kumar Vadivel. You can call me Dr. V. I'm very excited to be with you all here tonight. Let me tell you a little bit about myself. Although Shai said a few things, I'm a board certified periodontist, which means I'm specially trained in taking care of gums and bones that surround our teeth. And I'm also skilled in dental implants and oral surgery. I'm part of the American Board of Periodontology and the American Academy of Periodontology. And that's just a fancy way of saying I work with a group of dentists who are experts in gum health. I started ToothHQ Dental Specialists, and we have, as you guys know, 4 offices in the Dallas-Fort Worth area. We are all about making sure that your teeth and gums are healthy and strong. Now I'm here for you. I would love to hear any questions you might have about your teeth or gums. You can ask us your questions here live right now, or send them your questions for our next show. Your questions really help us make these shows helpful, not just for you, for everyone. And one more thing, if you love and like what you learn here, and please let us know. Shai needs some kudos. Yeah.
Thank you. I'll take the credit.
Your feedback is super important to us, and don't forget to like and subscribe to our channel so you won't miss out on the latest and the greatest updates and helpful tips for your dental health. I am looking forward to talking with you and answering all your questions, and let's make our smiles the best they can be.
That's right.
Okay.
Absolutely.
Okay.
All right, you guys, no further ado. We'll jump straight into the questions. Definitely put your insight and your questions in the comments for our live segment.
Okay.
But first question, Dr. V, I maintain excellent oral hygiene, brushing, flossing, eating healthy, and getting regular checkups. Yet I still get new cavities each visit. Could I just have bad teeth syndrome?
Definitely possible that you can have what we call it as a bad teeth syndrome. We always have ways to look for excuses, I should say, right? I know you can have genetics, you can have some saliva issues, and maybe have some hidden sugars or any type of acidic foods that you may be high on, and maybe you have a little bit of pH, meaning like acidic versus alkaline imbalance in your mouth, and you may have like a the bacteria in your mouth or the oral microflora in your mouth could be different. These are like possible causes, right? And but having said that, the bad teeth syndrome could be real, and although it is kind of like kind of a loose term people use, and people who are really looking for excuses can do that, and that's what they say. However, having said that, so how can we overcome that? Let's talk about not the problem, the solution, right? So it's kind of like, if you have diabetes or heart problem that runs in your family, are you at a higher risk for getting those heart problems and diabetes? Of course. However, if you lead a healthy lifestyle, meaning like you eat right, you exercise right, and you go to the doctor right, and if you do all of those things, you can overcome that. So, although the bad teeth syndrome could be real, you can contract from your mom or dad or your family members, but you can overcome that by, for example, using fluoride mouthwashes, using some sugar-free chewing gums, and going to the dentist on a regular basis, being extra diligent about doing some saliva testing, some bacterial testing, and getting your oral hygiene care like every 3 to 6 months, and getting sealants and fillings and gum disease treatment if you happen to be in the Dallas-Fort Worth area at ToothHQ. So,
come see us.
Right, correct.
That's right. Okay, and go see your regular dentist. All right, so I'm 20 years old and I have a peg lateral and a missing lateral incisor. What are my options to correct my smile, and how much might it cost in Texas? Well, where do you live, buddy?
If you are in Texas, and definitely, whichever part of Texas, if you happen to be in the Dallas-Fort Worth area, come see us. We can definitely help you. So to answer your question, peg lateral and a missing lateral, just to kind of help our viewers here, peg lateral meaning like it's one of the side tooth here, right there. It's kind of like a little smaller. Lateral incisors meaning not like your Mickey teeth in the front, the one side by. Those are the lateral incisors. So if you have those conditions, and what are your options to correct your smile? If the peg lateral is not like too small, if you want to correct it naturally, you can possibly get some braces and then kind of bring them on together, and that's kind of like a more natural way to correct that, and then replace the missing tooth with the dental implant, and you can make it kind of match the other peg lateral. You're done. However, if you are not happy with the size of the other peg lateral, that which is a smaller tooth as compared to the regular sized lateral incisor that we call it, what you can do is you can again get braces to increase the space of it to make it match to the other side, and then you can get some equally sized lateral incisors on both sides, so that way the smile looks so natural. So to answer your question, the missing tooth needs a dental implant, but if you're concerned about matching them to make it exactly look the right side look matching to the left side, then you will need a combination of braces as well as a dental implant. And also the other options are you can get some veneers, which are like not the best way, not the most natural way to correct that. Also you can get some you can get a partial denture, meaning like a flipper to replace that, and again it's not the best way to replace that. So you got multiple options. As Shai says, go
see your general dentist.
There we go.
Or
and
us.
And us. Yeah.
Yeah.
Because you're in Texas.
Isn't how much money it costs in Texas?
Well,
maybe they'll travel.
Yeah.
Maybe they're coming.
Don't you have you not watched the YouTube video? We had few patients travel all the way from Houston, right? Yeah. Mm-hmm.
They came to see me.
Yes, that's correct.
Yeah. So is the tooth missing, or did it get pulled? Like people just are born without incisors?
Thank you for bringing that up. And so it sounds like if you are a 20-year-old, more than likely, and I'm assuming that because you have a peg lateral, you possibly might have born with the smaller tooth on one side, and you possibly did not have that tooth come through at all, or you may have lost it. But from the sound of it, it looks like or sounds like this person did not have the tooth come in.
It just didn't come. Okay.
And the lateral incisor is one of the most common missing tooth if a tooth were to ever miss in the mouth.
Interesting.
Yeah.
Okay. Can you notice in your smile if you're missing an incisor?
Absolutely, yeah. But particularly if you have a gap, yeah, absolutely you can.
Oh.
Yeah.
So there's just a space there where the tooth didn't drop? Is there a baby
that's
tooth
correct.
there?
Yeah. Well, it's possible that like they may have a small baby tooth, or the baby tooth fell out, because the baby tooth usually goes away at that particular age, then the permanent tooth never came in. So the baby tooth thought, okay, I don't need to be there, I'm going to go away, but the permanent tooth never came in. Yeah.
And there's a gap?
There is a gap. Right.
Interesting.
Right. Yeah.
Okay. Very nice. So next question. Hi, doctor. Is it possible to treat gum disease using natural remedies, or is professional treatment always necessary?
This is one of the most common questions people generally ask, oh, why do I have gum disease and why can't it be cured using natural remedies, right? Absolutely, depending on the condition of your gum disease, it can either be cured via like natural remedies, or you will need to have some kind of a professional treatment to begin with, followed by the natural remedies. So it's kind of like I always give patients to give the example of like diabetes, for example, right? Can you cure completely like naturally? But you got to find out, what level of diabetes that you have. Unless you go to the doctor, you won't even know sometimes you have diabetes. So the same way. So when you go to your dentist and they are going to diagnose, and then they are going to diagnose depending on the condition of your gums, they are going to diagnose whether you have what we call it as gingivitis, which is the most early, the earliest form of gum disease, followed by you have mild, moderate, or advanced gum disease. When you have gingivitis, yeah, just with a regular cleaning, and followed by due diligence with at home care and some of the oral hygiene products that you can use, it is very easily reversible. Mild or moderate gum disease, right? So what that means is, if you have like some kind of a tartar stuck in there, it's possible that you can get it out with the regular cleaning, or what we call it as a scaling, again without having to do any numbing or anything. It can be reversed. But when you have moderate to advanced gum disease, then that is definitely going to require a treatment at the dental office, which means we have to give you some numbing, go under the gum line, and then we pretty much do what we call it as a deep gum therapy, or a deep cleaning in our office. If you happen to be here in the Dallas-Fort Worth area, we also do what we call it as a laser treatment,
yes.
Right? What we call it as an adjunctive therapy, to help expedite the healing process and control the bacteria and enhance the healing process. Followed by that, then now you do your own gigs, right? And so now you want to maintain it, because you got the initial therapy done, either a regular cleaning or a deep cleaning done. Now you maintain it at home with oral hygiene, which is the first thing, and also using products like could be as simple as a saltwater mouthwashes. People ask me, oh, do I have to really go buy expensive mouthwashes from the store? You don't have to. If you want to really simply start with some saltwater mouthwashes, go for it. People ask me, hey, can I do oil pulling? Absolutely, you can do that, but on the top of the brushing and flossing. Antibacterial, like other stuff. One of the patients that today I saw, he was asking for some turmeric, and he was asking for some aloe vera products. But again, I told them, again, on the top of the brushing and flossing. Green tea is a great antioxidant you can use, although you can have a little bit of staining, but you can overcome that. And the most basic thing is the proper brushing and flossing. There is no replacement for that. So use the brushing and flossing, water jets, and water picks, and the handheld for flossing, all the other products that we talked about. They are all icing on the cake. Go for it.
I thought water jets were in jacuzzis. I thought water jets were in jacuzzis.
Well, yeah, but they do have for the gums also. So bring the jacuzzi for the gums.
That's right. Okay, an oral spa.
Yeah.
All right.
Yeah. That's a good word. Yeah,
oral spa.
There we go.
Yeah, I don't know. Maybe we should open a practice for me specifically called
We'll do it.
oral spa.
Shy's Oral Spa.
Exactly.
There we go.
I think we'd be booming.
You got it.
All right. Next question. I saw the dentist yesterday. Is it safe to swab my inner cheek for a test? I have an operculum.
Operculum, yes.
All right. Gosh, very grammatically. Correct. Thank you. And loose gum near my lower right wisdom tooth.
All right. So what an
test.
operculum, meaning like when you have, I'm going to show you guys a picture if I can. So an operculum is like when you have a lot of gum tissue growing around a wisdom tooth, it is kind of like difficult for you to keep that clean. So that's what we call it as an operculum right here. See that?
Is it
Little
operculum
thing.
or operculum?
Yeah, operculum. Yeah.
Operculum.
Operculum.
Okay.
So the tiny little gum tissue that you have right here, that's what an operculum is. So as you can see, the gum, the tooth here is a wisdom tooth that is lying under the gum line, and it is starting to come through, but it is not able to come through, and it's kind of trying to push through the gum line, and now it is making the gum to kind of a little bit swell, or because you have a flap of gum tissue sitting on the top of the tooth right here, you got like a lot of food getting stuck under. You can't really keep it clean because you can't go, if this is the tooth and you can, if this is the tooth and when you have gum tissue, you can't really go underneath to keep it clean. Now you got a lot of swelling on the gum tissue because of the bacteria, or you're probably biting against the top tooth and it kind of swells up. So to answer your question, whether can you swab the inner cheek, and I'm not sure like the reason why you're asking for the swabbing the inner cheek. It is absolutely safe for you to swab the inner cheek if you have an operculum. That has nothing to do with that because the operculum is all the way to the back. But swabbing the cheek, meaning like I'm thinking that you're talking about just on in the front of it. So depending on the reason why you are asking, and it is okay for you to swab your inner cheek even though you have an operculum, and the most important thing of the discussion would be definitely get the operculum taken care, which means you can possibly have some infection started, or you may start to have like a pus pocket, or you may not start to have experience more pain from this erupting wisdom tooth. So get that checked out.
Absolutely. Do you know what I call an operculum?
What do you call an operculum?
Do you know what I call it? I call it a 7220. A 7220.
Oh, okay, got it. Don't get too technical. Tell them what a 7220 is.
It's an operculum.
All right, so Shai is trying to be, what do we say? Funny, right? Okay, funny. You know, no, I was going to say trying to be a smarty pant. I was going to say.
Okay.
Yeah,
that too.
So yeah, because she's trying to be a smarty pant, and she's using a lot of technical jargons, and so when you have, all right, okay, I did that for you. Okay.
Thank you.
So what she's saying is when you have an operculum around a tooth, then that's possibly the code that we may be using when you have like a little bit of a flap sitting on the top of that.
That's right. Shout out to my treatment coordinators. Yeah. All right.
Well, I want to tell them a story. Okay. So the one of the most common reasons, right, like why you will need to be concerned about the operculum, right? So you're going to be in pain if you leave it for a long time. So I once had he's a singer. So he was going to sing in a concert, and he was experiencing so much pain, and the concert is over the weekend. It was going to happen on the weekend. But everything started on Friday night, and he's supposed to sing on Saturday or Sunday. I can't remember the exact date. So what do we got to do? So if I'm going to, the right treatment is of course to remove the wisdom tooth. That's the permanent fix. However, he was experiencing so much pain, and he said like, hey, I cannot remove the tooth, and I can't expect to go sing in a concert. I don't expect that either, because we normally recommend taking rest, right, and at least 24 hours after. So what we ended up doing for this patient is, after giving a little bit of numbing, so we went ahead and used the laser to just remove the little piece of gum tissue around the mouth. He was able to keep it clean, and all he did was take some antibiotics and then take some just regular pain medications like ibuprofen, because he didn't want to take any stronger pain medication before the concert either. So he was able to very successfully perform the concert, and guess what? Like, he was so thankful because we were able to get him out of pain, and he was able to perform the concert.
Very nice.
Mm-hmm.
Yeah. So that's the benefit of lasers, buddy.
Mm-hmm. You got it.
Absolutely. So we'll take a break and jump into our live comments. Thank you guys for sending them in. First live question is, my bite feels uneven after recent filling and my gums on one side hurts. Could this be related?
Absolutely. Can the bite affect the gum? That's pretty much the bottom line question, right? Whenever we treat gum disease as periodontists, as you guys know, we are all about treating the gums and treating the health. One of the most unnoticed problem why the gum disease happen is the bite issue. The bite issue. So whenever you keep biting, you just tend to kind of wiggle the tooth in the bone case. When you wiggle the tooth in the bone case, guess what? Like, you have gum tissue starting on the top of the bone. So when the tooth starts to move, then now you have the gum tissue starting on the top, and that was is going to start to hurt. So guess what? The same thing. Whatever is going to put pressure, just like I said, the bite causes damage to the gum. Same thing when you have like a high filling, particularly if you have left it out for a long time, when you keep biting, and in your case you said like just last week, can that still hurt? Possible. But particularly if you leave it for a long time, that is going to really swell up the gum tissue. And in your case you said just last week, it is very possible because of the high bite that you have. Like, whenever you keep biting, that is going to translate some force into the gum. It is very possible that you may be hurting. Long story short, like, you definitely need to go see
Us or your general dentist.
Dentist, absolutely. Yeah. Okay.
Or us.
Yeah.
Right.
You got it.
Okay.
Yeah.
Very nice. All right, so we'll jump back into our viewer sent in questions, and then keep posting your live questions and comments, and we'll address them before the end of our podcast. So, hi Dr. V, my aunt is planning to travel for full mouth dental implants. How much rest and recovery time is typically needed, and is it safe to travel shortly after the procedure?
So we call it as a full mouth dental implants, or people call it like with the different names, all on fours or all on X's, and or fixed dental teeth or fixed implants or denture implants. A lot of names people are going to call it. Pretty much the bottom line is the patient needs to have all the teeth removed, either on the top, implants placed and teeth put in, or on the bottom, all teeth removed, implants put in, and set of teeth. Either it could happen on the top or the bottom or on both. So the typical recovery time, it used to be like kind of long, and nowadays, people go back to work like as soon as maybe in next day. Sometime, this is what I tell my patient, hey, how long you think the recovery is going to take? I tell them, I really don't know you well enough to tell you the exact, the time that you are going to take. But typically, like 2 to 3 days, expect some mild swelling. Nothing is going to get you bound to bed. But you may have a little bit of a chubby cheek, a little bit of swelling, some soreness, and possibly some bruising. Kind of like it's very normal for the first couple of days. About 4 to 7 days, kind of gradually return to kind of light activities. During this time, from day 1 till day 4 or 5. Keep yourself on soft diet. If you come to our office or any other office, we're going to give you like a list of soft diet you can be on. About 2 weeks and you are going to still be kind of healing, and at that point gum tissue is going to start to heal. That's typically when most of the dentists, we bring you back for like kind of a follow-up. And after that, like if everything goes well, by the end of like that 1 week or 2 weeks, you're kind of into a smooth sail. Then at the end of like about, nowadays we do permanent teeth as soon as maybe the next day or the next couple of days. At the end of 3 months, you're going to get your final teeth. Absolutely, you're good to go. The second part of your question is, Is it safe for you to travel? Absolutely, it is safe for you to travel. You can travel as soon as the same day, or you can do like within the next day, or like 3 to 5 days. Air travel, I check with your dentist depending on like what you had done. Check with them, although it is definitely safe for you to travel on the plane also. One thing that you have to be really careful after a long procedure after a long procedure is if you're traveling on the same day. If you're traveling, again, I'm reiterating, this is very, very critical. If you're traveling on the same day, then do not like sit there like and let your legs hang, or do not sit on the plane, let your legs hang for a long period of time, because a lot of times after surgical procedures, if you're not kind of mobilizing well, then you may end up getting a blood clot in your legs, and which is going to be very, very life threatening. So particularly if you have medical conditions and like diabetes or high blood pressure or other medical condition, that is going to really put you at a high risk. So make sure that you are going to check with your dentist whether you are a high risk candidate for that. And then most importantly, stick with the medications and the dentist is going to give you. And then most importantly, stick with all the recommendations and post-operative instructions the dentist is going to give you. Read them carefully, take the pain medication, and have a safe recovery.
That's right. And here at ToothHQ, we'll send it home with you written down.
Absolutely.
So you don't have to worry about forgetting. So before we jump into my favorite segment, we'll answer another question. Hi, Dr. V. I'm just 20 years old and I've noticed some patches on my gums. Can these gum issues be treated without undergoing a procedure?
So it really depends on what kind of a patches that you're talking about, right? The patches could range anywhere from, like, it could be just due to like a poor oral hygiene. I find it like a lot on smokers, and it is very, very common. And it could be like as simple as it could be like a fungal infection. Sometimes I notice them on vitamin deficiencies, and sometimes it is due to like some kind of a pigmentation that you may have. And then another main reason, when you have gum disease, a lot of times patients do not know they have gum disease, and they have a lot of tartar that gets stuck under the gum line now, and it causes like a lot of red irritation around the gum line now because of your gum tissue like always pulled with saliva, like it's wet all the time. Now it becomes kind of like a really white. So there are a variety of reasons why you could be getting the patches, and most and the riskiest problem, or the risk that you are in, is when you ignore the white patches. A lot of times, these could be cancer. I'm not trying to scare you here. And if you're a 20-year-old, could you have cancer? More than likely not. But it's still always recommended if the patch is not like we are not able to scrape it off, or if it is something serious, in addition to getting gum disease treatment if it is required. And sometimes we may even recommend like a biopsy, particularly if this white patch has been persisting for more than 2 weeks. But irrespective of that, just get it checked out. And these are the variety of causes. You already heard it from me. And bottom line, just like Shai says, always go to
us or your general dentist.
You got it. Thank you.
That's right. But general dentists don't do biopsies.
They do not, but at least they can diagnose, right? If it is related to gum disease, then they may be able to treat it. And if it is a biopsy, just like Shai says, they may not do the biopsy, and then they will be sending you over to us, or like a surgeon like us. Yeah.
That's right. Okay. So we're going to jump into our game, which is so much fun for me because he lost last time. So
Sure?
100%.
Okay.
It's recorded.
All right. Yeah. Okay.
Okay. So,
What is the game book, by the way?
rapid fire.
Oh, okay.
Yes.
Got it.
You only get 60 seconds to answer a question within like one
So
or two
60
sentences.
seconds for one question.
Nope, that was a lie. Okay. We'll say 3 seconds.
Okay.
1 to 2 sentences, okay? For sure. That's what we're
Okay.
checking for. Absolutely. And it looks like you have more opportunities to
Okay.
Yeah.
Well,
not
find out.
go over that. Right.
Okay.
Okay. First question. What are the 5 signs it's time to see a dental specialist? Specialist, not a dentist.
Dental specialist, right? Okay. Continuing pain, gum disease, inflammation, bad breath, persistent looseness of the teeth.
We'll give you that one because you didn't use any sentences.
Okay.
All right, there we go.
So I gotta be in fragments, huh?
So
Okay.
you're gonna win.
All
You
right.
gotta beat the game. Okay. What are your 4 habits that keep your gums healthy?
Brushing, flossing, going see the dentist, and make sure that I'm consistent on those.
Oh, you're a cheater. Okay, got it. What are the 3 common myths patients believe?
White patch may not be a cancer. Gum disease does not spread. Gum disease does not cause like systemic issues.
Okay. What are the 2 reasons people avoid the dentist but shouldn't?
They avoid it, but
Shouldn't. What are
should-
2
they
reasons people
should-
avoid the
they
dentist
should.
but shouldn't?
Okay, well, the most common reason is the anxiety and the pain. They
Okay.
should not be afraid.
Sure. All right, last one. What's the one thing you wish everyone knew about periodontal health?
I say this every single time. Do not think that periodontal disease is a localized disease. Gum disease spreads into not just the entire mouth and to the entire body, and not to the entire body. It spreads into your family and your spouse.
That's
Do
right.
not ignore.
And what do we call that?
Mouth, you say that?
No, you tell us.
Mouth-body connection, or the kissing link.
Okay.
Yeah. you
That's
got it.
right.
Yeah.
Yeah. Come see us so we can go over it with you, buddy.
Yeah.
All right. I don't know if you won that one. I think you just found a way to cheat the system.
Okay. All
Yeah.
right. Okay.
Seems strategic.
All right. Okay.
Mm-hmm. All right. So we'll jump back into our questions that were sent in by our viewers, and then we'll try some live questions again. So please make sure you're sending them in. Hi, Dr. V. My lower canine appears longer than the one on the other side. Is it possible to push the tooth down into the gum to make it look even?
All right. So can we make it even? Absolutely. There are many ways to make it even, right? However, but I need to know the reason why the tooth is looking longer, right? If you have gum receding and that's what is making the tooth longer, then it's an easy fix, and that is what I do all day long. However, what about like what we call it as a canting, which means like you're born with like one side higher than the other, and the lower side is making your tooth longer. So then that means like it's like a longer fix. You may have to do braces, and you may need to have some kind of a surgical procedure, or if you're born with it, and we may not be able to even fix that. But what about like the tooth did not push all the way in, and that is why the other side looks longer, but this side like a little shorter. Then braces are easy way to fix that. What about your tooth itself, like slightly shorter on that side, although it has come all the way, you don't have any gaps or any of it, then that's again an easy fix, and you can put like a veneer. So there are multiple ways like you can fix that by contouring, or like braces, or gum grafting, or like a veneers or bonding. The answer is go see the dentist, and they can definitely help you. And
right.
if you need a periodontist, and if you are in Dallas, and you can come to ToothHQ or wherever you are, go see a periodontist, and if you needed a gum grafting.
If you're in Dallas, come see me.
Okay, all right. Come see Shine, not Dr. V.
That's right.
Yeah, because you're
be
the
a doctor.
You got it.
Yeah.
Okay.
Mm-hmm. I think somebody called me Dr. Shy last time.
Oh, yeah, that's right.
Yeah.
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 I remember that. Accidents happen.
No, I don't think it was accident. I don't. I think she might have been confused, but I'm so knowledgeable
All right,
in the moment.
all right. Let's move on with Shai.
sure.
Let's move on. Let's talk about the people, not Miss Shai. Okay. Okay.
If you insist.
All right. Okay.
I think they like to hear about me, but it's
Okay.
fine. Okay. No worries. Next question. Can gum recession be caused by jaw misalignment? If so, what are the possible solutions for correcting it?
All right. This is one of the most commonly asked questions, and I shouldn't say most commonly asked question. It's the most unknown fact, and people say like people are this is typically what happens in our practice. So patients go to the dentist, and then the dentist diagnoses, you have gum receding. I want you to go see Dr. V, or I want you to go see ToothHQ. So a patient comes here and we tell them, well, you do have gum receding and you got to fix this with what we call it as a gum grafting. Patients say yes, and then I kind of look at them, and then patients sometimes ask me, why are you looking at me like this? You never asked me, like, why you had some gum recession to begin with. Some patients do ask. Most patients, they do not even have the knowledge to ask. So I tell them, and before they even ask, and I even tell them, hey, you didn't ask me why it happened and why you need to fix that, right? The reason you need to fix that, you don't want the gum receding to continue, and you are going to end up losing the teeth. So that is the reason why you want to fix that. But can that happen because of the jaw misalignment? Absolutely. One of the most common reasons, like I tell the patient, is because either you were born with it and you had some kind of a misalignment, the tooth kind of got pushed outside a little bit and around the bone case. Now it's kind of like stretching the gum tissue, then that made the gum tissue thin, or the bone kind of pushed the bone and kind of almost pushed the gum away, like gum down. That's what would cause the gum receding. And not that because you're born with it or misalignment, it's not uncommon that might happen even during braces. The orthodontists are very good about telling the risk of getting the braces, and this is one of the most common risks. So they will tell them sometime to prevent the gum receding from happening during braces, we do the gum grafting prior to getting the braces started. Or if you happen to, or the orthodontists happen to notice any gum receding, they will send the patients to us during the braces process, and then we'll do the gum grafting, send them back to the orthodontist for them to finish up with the treatment. So to answer your question, yes, the jaw misalignment can cause the gum receding. The ways to fix that would be either the gum grafting or a combination of gum grafting and the orthodontic treatment, and then followed by that, like the long-term fix would be, you probably would need to get some kind of a bite adjustment and a night guard, so that way we can prevent this from happening. Very rarely we will combine other modalities, and one of the most common things that we recently started doing is to combine the laser treatment at the time of the gum grafting, so we can expedite the cleaning process by controlling the bacteria.
That's right. Okay, right before we jump back into live questions, we'll do another hi. Oh, I'm 31 years old. He didn't say hi, sorry. My gums look normal, but I've been experiencing slight sensitivity. How can you tell the difference between normal gum sensitivity and early signs of gum disease?
If you are looking to, like, what are the early signs, right? Like, so, and I'm glad like you are paying attention to this, because you're really looking for like early sign. The early signs are like even before the bleeding starts, right? Like, so when you have like some kind of a sensitivity, before the bleeding starts, the gum tissue may start to look a little bit pink, or not pink, reddish, because the gum tissue is supposed to look pink and it needs to be formed. So if it starts to look a little bit sore, or you start to look a little bit reddish, and these are the early sign. Bleeding again is kind of like a little bit of an early sign also. Redness and swelling in specific areas, and bad breath. Sometimes it could be an early sign. Before other things happen, bad breath comes in, and then gums will start to recede. So that could be an early sign of a gum sensitivity also. So these are all kind of the signs and why the gum tissue is sensitive. Sometimes it is hard for you to differentiate between the tooth sensitivity versus the gum sensitivity, because when the gum tissue starts to pull down from the neck of the tooth, if you have a little bit of exposure of the tooth, you may have some sensitivity also from the gum tissue pulling away. So either way, all of these are kind of like fixable, and particularly early signs are very easily doable, and these are not only fixable, but these are very reversible. But if you happen to have gum receding, then talk to your dentist early enough, and the dentist will be able to fix that or send you to like a periodontist like us to get that fixed. Yeah.
That's right. You said that wonderfully.
Thank
Like
you.
us. Periodontists,
Perfect.
like.
Thank you. Like us. Perfect.
Absolutely.
Thank you. Finally, I'm getting some kudos.
I know, you're doing so well
Sunshine.
today.
Yeah,
Goodness, I
all
must
right.
say.
All right.
Okay. You learned something.
All right, man.
That's right.
So, okay.
We're here to
all right.
teach.
Pat on the back for me. Okay.
Absolutely.
all right,
You
okay.
deserve that.
Okay.
Double. All right. So we had a really great live question that was posted. How long does it take for damage to occur when herbs, peppers, or popcorn get stuck under the gum line? Interesting question.
Right. So the question is, anything that stuck under the gum
Pretty much.
line, anything that gets stuck under the gum line, it is going to cause damage. So the answer is, like, if you know that something got stuck under the gum line, you're going to get it out, and then you may not have any problem unless you cause some really serious damage. You know, I got a patient and they bit into something really hard, and they like literally tore the gum away, right? Then that means, you know, you can't do anything. The damage already happened by the time you saw me in a couple of days, you know, so that already happened. But if you feel like you got something stuck under the gum line, if you get it out, and then after that, like, you don't have any continued problems, soreness, no pain, gums look fine, and not everything is like everything as usual, then can you go to your dentist and then have them check it out when you go for the next appointment, which is great. But if you got something that's stuck under the gum line, and if you completely ignore it, meaning like it is sensitive, you feel like there is something got stuck and you can't get it out, now you're starting to get some pain, you're going to start to get some soreness and bad breath and bleeding, you're using all the gadgets you can, like the floss and the toothpick and any tool that you can have and you can think of, but you're not able to get that resolved, then that's time. That's like a sign that you gotta go see the dentist, because if you do ignore, then you are going to get a pus pocket, and you are going to get which is called an abscess, or you are going to get periodontal disease or gum disease. Now you may end up literally tearing the gum away, and that is going to cause even more problems and suffering through pain and bad breath and all of that. So if it is not resolving immediately, go see the dentist. If you're able to get it out, great. Again, still get it checked out with the dentist when you go the next time.
That's right. Do you know what I tell people that like leave food stuck in between their teeth or under the gum line?
What do you tell them?
Mm-hmm. You know what I tell them?
Tell them, yeah. I haven't heard you say that.
Interesting. Okay. What I tell them is it's the same thing of leaving food on the counter
Oh.
and it starts to mold and like bacteria forms. It starts
That
to.
is exactly what I was telling. So I had 3 patients.
So you've
back
been
to
stealing
back.
my words.
No, I didn't know what you were going to say. Probably you stole it from me. I'm your inspiration.
I'm the doctor here.
Oh, man.
Please respect me.
So this is exactly what Shai said, right? So why do people get bad breath? This is one of the most common questions that I asked, right? So, hey, I have periodontal disease. I'm kind of twisting that, right? Question that you said. So why do people get a bad breath from gum disease? It's exactly
Decay,
what you
bacteria,
said. No, that's exactly what you
food
said.
underneath
man.
the gum line.
Food
Yeah.
underneath the gum line. So literally, like, this is exactly what I say. This is my spiel. People get bad breath, and we actually had the nurse, remember, yesterday in Cedar Hill? Mm-hmm. So that is exactly
Oh, she
what
did
she was
ask.
asking. Yeah, so she was asking. This is like what, like Shai said, when you leave the food over the counter, like on the counter for a few days, what happens? The food gets really rotten. When you have gum disease, when you leave the food like that gets stuck under the gum line, the food gets really rotten. Now it is going to start to create a bad odor, just like the leaving the food over the counter. And then also, and one thing that you may have said or may not have been sharing with your patient, I literally tell my patient the bacteria are the bad guys. I tell my patients to kind of sometimes grows them out. The bacteria are literally peeing under the gum line, and it's just like the bad odor because they release the toxins. I mean, when I say peeing, means like they release the toxin. The toxins are like the bad odor because they kill the antioxidants, and they are the other way around. Now they cause the bad odor. Now they are causing the bad odor. So those are the two common reasons. The bacteria get stuck under the gum line. The bad odor comes from the food that's left, which is nothing but bacteria. So no matter what, go get it checked out.
That's right.
Bad
And brush
odor.
and floss.
Bad odor, brushing and flossing. Bad odor, unfortunately, causes problems in the relationship too. A lot of time people say Mrs. complaints. All right.
Do you know anything about that, Dr. Vadivel? Do you want to explain it for the people?
No, you say that. Why don't you
I
say
didn't
that?
say that.
No, I'm
didn't say
saying
that.
the Mrs. complaints. Like I joke with patients. I tell them, hey, is that just you or the Mrs. complaining, right? That's exactly what I was asking. The patient who had the nurse we talked about in Cedar Hill, Texas. So I asked her, hey, so let me ask you, it does not like when I look at the problem, it does not sound like look like a serious problem because you seem to be maintaining good oral hygiene. You are a nurse, and then the gums do not look bad. So is that just you thinking about it, overthinking about it, or your partner is complaining? And guess what she said?
Her partner's complaining? Oh, about her breath.
About her breath.
Oh, I thought you were going somewhere else with it. Yeah.
Yeah,
Him
right.
and his dental friends, they have this little joke they enjoy.
Holy crap!
Yeah.
Holy crap!
We won't
Okay.
put you guys out
All
there.
right. Okay. All right.
That's where you were going.
Okay. All right. Okay. Yeah.
All right. Yeah. We'll just slide past that one.
Okay.
So we'll jump back into our questions, and then we'll do another live question. So keep sending them in.
Thank
My
you.
daughter, absolutely. My daughter is 15 years old. She used to have pink gums, but over the past year, that has changed. How can we help restore her gums back to a healthy pink color?
Well, first thing is just because the gums do not look pink, that doesn't mean you need to have a treatment done. Unless you have unhealthy gums, meaning it looks red, puffy, swollen, bad breath, bleeding, and that is the case. Yes, you need to have some treatment done. But when you grow, sometimes depending on the ethnicity of the people, sometimes the gums have a tendency to change color. It could be due to some kind of a melanin pigmentation. If that is the case, it is absolutely normal. You don't need to worry about it. However, if it is because of the tartar, right? Like I said, whenever you have disease, if it is due to plaque or the tartar buildup, which is going to happen under the gum line, if that happens, then you need gum disease treatment. If it is due to some kind of a hormonal changes, and if it is a regular hormone change, great. If not, then get it checked out with your doctor. Then and yet of course the dentist also, whether there is any kind of a hormonal treatment that needs to be done. And people smoke and people vape, and that is one of the reasons why the gum tissue change, because you're literally kind of heating the gum up, and then you're kind of boiling the gum up, and then that kind of changes colors, and the gum tissue becomes really pale white because you compromise the blood supply. If that happens, then again, cutting down on smoking and vaping, it is going to help, but again, check it with your dentist. Sometimes it could be due to medication. Do you remember the patient that we had again in Cedar Hill yesterday? The last patient, we are going to try and do the laser treatment, and for financial situation, we decided to do the gum treatment. Yeah, the deep cleaning. So that patient was on 4 different blood pressure medication. So when you are taking multiple medication, particularly the blood pressure medications or sometimes the seizure medication, they have a tendency to overgrow the gum tissue. We call it as a gingival hyperplasia, or overgrowth of the gum. So it could happen because of the medication. Sometimes when you have this overgrowth because of the loss of blood supply, sometimes those kind of appear to be white also. Again, the simple answer is go see your dentist, get it checked out, find out the real reason, whether it is normal for you to have this, or it could be something critical that you need to get it checked out. With your daughter being like about 15 years old, should you be worrying about multiple things that I mentioned? Probably not, but I don't know your daughter's condition. She could be taking seizure medication. That probably could have happened. So get it checked out with your dentist.
Okay, so before we jump into live questions, I'm going to take that a step further. Are you saying that if an individual gets their routine cleanings consistently, or if they get their hormonal issues looked at, or if they quit smoking or something, will the gums reverse?
Yes or no is the answer. But if you have really healthy gums, then if you revert back to your routine habits and quit smoking and going to see the dentist and keep following the real brushing and flossing, it is very possible it will reverse back. But if you already have started having signs of gum disease, which are the bad breath, bleeding gums and swollen gums and receding gums and all of that, you need to get that treated first at the dentist. Then you quit your habits. Then you follow diligent oral hygiene to get things under control.
So they're going to revert back?
It will, yeah.
There's chances
you can get
they
it
can
controlled.
revert back.
You can at least control it. It is not going to completely reverse it, but you are going to almost get it under control. Yeah.
Does that mean pigmentation changes?
Say again?
Does pigmentation change?
Pigmentation may not change, because if it is related to either growth or it could be related to the ethnicity, it is not going to change. But if it is related to smoking or other habits, yes, it is going to change.
Oh, very
Absolutely,
nice.
yeah.
Okay, cool. That was for all of us, you guys. Alrighty. Do I have another question? Okay, no, I think we're good. Alright, so we'll jump back into our live questions. Oh, I do have a question. Is there anything you can do outside of stopping your habits to change the color of your gums? Is there treatments out there for that? Like a shortcut, a little cheating way.
Is there a reason you asked me that question?
Possibly. As a doctor, I know things.
Golly, okay, I thought you already knew the question. I knew the answer.
I
That's the
do,
reason.
but I'm
Okay,
mentoring
all right,
you.
okay, gotcha.
So,
all right,
you know,
okay,
please.
all right, okay. All right, great question. So one of the most important thing, or one of the most reasons people ask for, like, hey, can I change the discoloration of the gums? People are getting married, or hey, when I'm smiling on my selfies, I'm showing too much of changed color gums or black or brown gums, and people are going to say, one of the things that we do in our office is laser
100%.
depigmentation. So the laser depigmentation, pretty much kind of like we go back and it's kind of like a dermabrasion, let's say, right? You kind of take a little bit of peeling away the skin to make it look fresh. The same way we kind of like we do the depigmentation of the gum using the laser, and kind of the gums get better, and I get asked the question, oh, if I do it once, am I going to get pink gums like for the rest of my life? I can't really answer that question, really depending on your body. Sometimes people never get it back. Sometimes people get it back within like a few years, and then we got to do it again. It's kind of like going to the spa, right? You can't go do like the surface peeling or the facial like once and then you can be done with it. You may have to do like a few times, right? So it's just like a lifetime. You may do like maybe 3 or 4 times or 4 or 5 times. But laser is a great option.
Absolutely.
Good job.
You're welcome, buddy. I know
Good
it was
job.
coming. Yeah.
Finally.
Oh.
Finally.
Oh, I think we recorded that. Consistency for me. Very nice. So you guys, we are running a little bit behind, but I did see a great question come into the comments. What happens if your body rejects the gum graft because of a autoimmune disease?
The reason your body might reject a gum graft, like more than I'm going to say like it's a rejection, I'm going to say like your body is not allowing the gum graft to heal properly, because particularly if you have an autoimmune disease, and I'm going to be extra vigilant in treating you, There are two ways to do the gum disease gum grafting. One, we either get the gum from the skin bank and we put it in, or we borrow the gum tissue from your own mouth. Particularly if you have an autoimmune condition, I definitely don't want to even give it a chance by getting the gum from the skin bank, because I don't want to take a chance. Like you're already autoimmune and I don't want you to go through multiple procedure. I want to do it once and then be done with it, to just give you the comfort of the confidence on me and then for the best healing, right? In my hands, knock on wood, like the gums from your own mouth, most of my patients do not ever complain at all. I'm pretty comfortable and confident that I can do the procedure without like much additional recovery, because one of the reasons why patients stay away from getting the gum graft is because sometimes some of the surgeons have to take a big piece of skin from the roof of the mouth, which can be painful. But I got my techniques for the last about 30 years. I've been refining my techniques, and most of the patients, like, they never complain about the pain from the second surgical site. So when you have an autoimmune disease, we take the gum tissue. I personally take the gum tissue from the roof of the mouth and put it in, and you're not going to possibly reject that. However, it's whenever you see like the results are not as great, and that could be due to the way the body is going to be healing. So to answer your question straight, if you have autoimmune disease, do not shy away.
I'm shy.
Yeah.
So I haven't seen my name up here today.
Yeah. Oh.
We'll talk about
You
that
did
later.
not see that.
We'll talk about that offline. It's fine.
Do not shy away from going to see. Trying to get the gum grafting, because you can always get that as an option. You can get that from the roof of the mouth, so you don't have to worry about that. And then if you have not the best results, it is not because the gum graft was rejected. It is because the gum did not heal. Your body did not allow for the gum graft to heal properly. Okay.
I'll ask a question for you, friend. Don't worry about it. Can you do PRF?
Man,
I tell you, I'm sharp.
are we getting a better air
know.
around here? Like
Sharpest tool in the box.
Man.
Man.
So, what Shai is asking is what can you do to enhance the healing when you have autoimmune disease? So, what she is saying is what we call it as a PRF, right? What that means is when you have like a compromised healing. For example, in your case, you have autoimmune disease. So, what we do to enhance the healing is we add a lot of growth factors to enhance the healing process. One of the ways to do to enhance the healing is what we call it as a PRF, meaning particularly if you are being put to sleep to get the gum grafting, more than likely because of your autoimmune condition, you may have a bit of an anxiety. We may put you to sleep to get the procedure. So at the same time, we are going to take a little bit of blood out from the same IV axis, and we are going to spin it, and we are going to concentrate all the growth factors, and we are going to put it here, which is going to enhance the healing. Let's say that like the patient is severely compromised. Now the patient does not want to be put to sleep. Then sometimes we can buy these growth factors from just over the counter. So we buy these over the counter growth factors, and we kind of put it, and what we do is after we take the gum graft from the roof of the mouth, we soak it in the growth factor, and then we put it along with that, or just like you said, after we put the gum graft over the tooth, and then we put the PRF, like we make it as almost like a skin, and then we put it over, and then we pull the gum tissue over, and that's just going to enhance the healing also. So definitely, if you are concerned that you are autoimmune, that is what is just kind of making you think that you need to do something, talk to your periodontist, your surgeon. There are multiple options available.
That's right. Well, you guys, please go enjoy National Tequila Day. It has been a great time.
What did you say?
Today is National Tequila Day.
Tequila Day. So that's why
right.
you absconded for a few hours in between.
Yeah, I'm about to go right now.
With
With that being said, it's time to wrap this thing up. Okay, there is a shot of tequila waiting for me.
All right.
That's right.
All right. Okay.
Okay, so-
All right. Thank you all.
Bye, guys.
See you next time.
Okay. All right.
Man.
I know I did so great tonight. I must say.
you did.
You know, I tell you, things I